Welcome back to the Living Diabetes podcast. I am your host, and this is your weekly companion for everything diabetes and endocrinology. Today, we are looking at a medication that has been generating a lot of excitement in the diabetes and obesity space. It is called Cagri, and it could change how we treat type 2 diabetes and weight management. If you have been following the GLP-1 medication story with drugs like Ozempic and Mounjaro, Cagri is the next chapter, and the results so far are genuinely impressive. So, what exactly is Cagri? It is a combination of two drugs in a single weekly injection. The first component is semaglutide. You already know this one. It is the active ingredient in Ozempic and Wegovy. It works by mimicking a gut hormone called GLP-1, which helps your pancreas release insulin, slows stomach emptying, and reduces appetite. The second component is cagrilintide, and this is the new part. Cagrilintide is an amylin analog. Amylin is a hormone that your pancreas normally releases alongside insulin after meals. It helps control blood sugar by slowing how quickly food leaves your stomach, reducing glucagon secretion, and signaling to your brain that you are full. In people with diabetes, amylin production is reduced, just like insulin. So, replacing it makes biological sense. What makes this combination powerful is that semaglutide and cagrilintide work through different pathways. Semaglutide targets GLP-1 receptors. Cagrilintide targets amylin receptors. Together, they appear to produce effects that are greater than either drug alone. Think of it like two different keys opening two different locks, both of which control blood sugar and appetite. Now let us look at the clinical trial results, because this is where it gets really interesting. In phase 3 trials, Cagri has shown A1C reductions exceeding 2 percentage points. To put that in context, if your A1C is 8.5%, this medication could potentially bring it down to around 6.5% or lower. Many participants in the trials actually achieved A1C levels below 5.7%, which is in the normal, non-diabetic range. The weight loss results are equally striking. Participants lost an average of 15 to 20% of their body weight. For someone weighing 100 kilograms, that could mean losing 15 to 20 kilograms. These numbers are among the best we have seen from any single injection therapy. And remember, this is one injection per week. In head-to-head comparisons, Cagri outperformed semaglutide alone on both blood sugar control and weight loss. The addition of cagrilintide clearly adds meaningful benefit beyond what GLP-1 therapy provides by itself. What about side effects? The profile is similar to what we see with existing GLP-1 medications. Nausea is the most common side effect, particularly when starting treatment or increasing the dose. Other gastrointestinal symptoms include vomiting, diarrhea, and constipation. For most people, these side effects are mild to moderate and tend to improve over the first few weeks as the body adjusts. The gradual dose escalation that is built into the treatment protocol helps minimize these effects. So who might benefit from Cagri? It is being developed primarily for people with type 2 diabetes who need better blood sugar control and would benefit from significant weight loss. It may also be developed for weight management in people without diabetes, following the same path that semaglutide took from Ozempic to Wegovy. For people who are already on a GLP-1 medication and doing well, the question will be whether switching to Cagri offers enough additional benefit to justify a change. For those who have not yet started this class of medication or who have not achieved their targets on current therapy, Cagri could be a powerful option. Now, when can you actually get it? Cagri is currently under regulatory review. Novo Nordisk, the company behind it, has submitted applications in several markets. Approval could come within the next year, though timelines in drug approval are never guaranteed. Supply will also be a consideration, given the ongoing demand for GLP-1 medications globally. It is worth mentioning that Cagri fits into a broader trend in diabetes treatment. We are moving from single-target therapies to combination approaches that address multiple aspects of the disease simultaneously. Tirzepatide, sold as Mounjaro, already targets two receptors, GLP-1 and GIP. Cagri targets GLP-1 and amylin. The future may bring triple combinations or even more sophisticated approaches. The bottom line is this. Cagri represents a genuine advance in diabetes and obesity treatment. The combination of semaglutide and cagrilintide produces better results than semaglutide alone, with a similar side effect profile. If the regulatory reviews go well, this could become one of the most effective treatment options available. As always, any medication decision should be made in consultation with your doctor. They can assess whether a new treatment is appropriate based on your individual health profile, current medications, and treatment goals. Follow us on social media for daily updates and more content. Until next time, take care of yourselves.